Blood pressure measurement. Blood pressure is a vital indicator of your overall health, and understanding how it's measured and what the numbers mean can empower you to take control of your well-being. What is blood pressure measurement? Blood pressure measurement is a simple yet crucial medical test that assesses the force of blood against the walls of your arteries as it flows through your body. It is typically represented as two numbers, systolic and diastolic blood pressure. The systolic pressure measures the force when your heart beats, while the diastolic pressure measures the force when your heart is at rest between beats. These measurements are recorded in millimeters of mercury, mmHg. Why are blood pressure measurements important? Maintaining healthy blood pressure is essential because high blood pressure, hypertension, can lead to serious health problems. It can strain the heart, damage blood vessels, and increase the risk of heart disease, stroke, and other conditions. On the other hand, low blood pressure, hypotension, can also have adverse effects, causing dizziness and fainting. Regular blood pressure monitoring helps identify and manage these issues. Common blood pressure measurement methods. There are two primary methods for measuring blood pressure. Manual blood pressure measurement. This method involves using a stethoscope and a blood pressure cuff, sphygmomanometer. A healthcare professional places the cuff around your upper arm, inflates it to temporarily stop blood flow, and then slowly releases the pressure while listening to your pulse with a stethoscope. This allows them to determine your systolic and diastolic blood pressure. Automatic or digital blood pressure measurement. This is a more convenient method that uses an electronic device to automatically measure your blood pressure. You simply wrap the cuff around your arm, press a button, and the device provides your blood pressure readings within seconds. Many people use digital home blood pressure monitors for convenience and regular monitoring. Interpreting blood pressure measurement results. Blood pressure readings are typically expressed as a fraction, with the systolic pressure, the higher number, over the diastolic pressure, the lower number. Here's how to interpret your blood pressure results. 1. Normal. A normal blood pressure reading is typically around 120/80ths of a millimeter Hg. The systolic pressure should be less than 120, and the diastolic pressure should be less than 80. 1. Elevated. If your systolic pressure is consistently between 120 to 129 millimeters Hg and your diastolic pressure is less than 80 millimeters Hg, you may have elevated blood pressure. It's a warning sign that you should monitor closely. 1. Hypertension stage 1. If your systolic pressure consistently measures between 130 to 139 millimeters Hg or your diastolic pressure is between 80 to 89 millimeters Hg, you may have stage 1 hypertension. 1. Hypertension stage 2. Stage 2 hypertension is diagnosed when your systolic pressure is consistently 140 millimeters Hg or higher, or your diastolic pressure is 90 millimeters Hg or higher. 1. Hypertensive crisis. A hypertensive crisis occurs when your blood pressure readings are higher than 180/120ths of a millimeter Hg. Seek immediate medical attention if you experience this. How the test is conducted. Blood pressure measurement is a simple and painless procedure. Here's how it's typically conducted. Prepare. Sit in a relaxed position with your back supported and feet flat on the floor. Make sure your arm is at heart level. Placement. If using a manual blood pressure cuff, the healthcare professional will wrap it around your upper arm, aligning it with your heart. If using a digital device, follow the manufacturer's instructions for cuff placement. Measurement. The cuff is inflated, temporarily stopping blood flow. It then slowly deflates while measuring your blood pressure. Recording. The healthcare provider or the digital device will record your systolic and diastolic blood pressure readings. For whom and what diseases this test is for. Blood pressure measurement is recommended for 1. Adults. Regular blood pressure checks are essential for adults, especially those over 40, to monitor their cardiovascular health and detect any potential issues early. 1. People with hypertension. Individuals with high blood pressure need frequent monitoring to assess the effectiveness of treatment and lifestyle changes. 1. Patients with chronic diseases. Those with conditions like diabetes, kidney disease, or heart disease should monitor their blood pressure as part of their ongoing care. 1. Pregnant women. Blood pressure checks are vital during pregnancy to detect and manage conditions like preeclampsia, which can be dangerous for both the mother and the baby. 1. Children and adolescents. Blood pressure measurement is essential for young people with risk factors or a family history of hypertension. Conclusion. Understanding blood pressure measurement is a crucial aspect of maintaining good health. regular monitoring, interpretation of results, and appropriate follow-up with a healthcare provider can help you manage your blood pressure effectively and reduce the risk of cardiovascular diseases. If you have concerns about your blood pressure, consult with a medical professional for guidance and personalized care. Your health matters for us. We are Quali.Health. If you want to effectively protect your health, get your all-access health pass at www.quali.health. Our health skills provide valuable information and guidance on specific health conditions.